with the chronic jaw pain, this is the part of my passion as well, to helping people, because they usually come and say like, "Doc, I have that clicking," or sometimes they even have a lot of pain and headaches, and they cannot relate that to the jaw position. So TMD or TMJ dysfunction, that's what we actually call that syndrome. It's a very wild subject, but for the patients to understand, they have to tell me what they do. If they grind their teeth, it's usually muscle related. Sometimes it's the position of the jaw that we can also see. That's where the orthodontics helps them. There is another group, it's a trauma patients. So those are a little bit more difficult and sometimes require a little bit more of the consultation with the oral surgeon. But patients who have grinding or have the jaw position, we can help them right here with different types of orthotic devices that help them separate. The orthotic obviously is something like we put a plaster on our broken foot. So it's temporary, but help us decrease the inflammation, decrease the pain, and take patient out of the emergency. Because very often the unlocked jaw that cannot open or close, it's an emergency for the patient. They cannot eat without making noise, that's an emergency. It requires a throughout exam, and we have a newest machine for that called CBCT, that we can see the jaw position, we can see the structure of the bone, we can see the airway. So it's very beneficial in our treatment planning to go through the exam to divide if this is something that we call organic problem, that means it's bone or trauma or something else that's caused irreversible problems, or something that comes from the muscles, like a grinding or the forward head position, or sometimes the teeth position, like crossbite. So dividing that will help our patient go through that plaster stage, as I call it, and then there is a finish case. So the finish case can be orthodontic, can be crowns, can be bridges, implants, or other kind of a finishing, including dentures. So it's a couple steps that we have to take with our TMD patient. But if you have a headache or you are unsure why your jaw is hurting you, it's a good to consult, because a lot of patients suffer from that, especially females. Females are prone because of the hormones changes and the weaker bone structure. So like 70% of our TMD patients are females, even teenagers.